If someone calls you out of the blue trying to sell you something, well, you all know what to do. Run. I got a story to talk to you about, and it's a word of warning for those of you on Medicare or have friends and loved ones on Medicare. Stay tuned. Hi everyone, my name is Rick McDermott with Senior Solutions Group, and I've been helping people, assisting them with Medicare planning, long-term care planning, and retirement planning starting in 1995. So that tells you that I am getting old. So I love helping people. We're passionate about what we do. We never promise people a smooth road. Sometimes it can be, but sometimes it can be bumpy. One thing we do promise people, though, is we're going to be with you every step of the way, through thick and through thin. Case in point, we had someone reach out to us this last week. They got a phone call out of the blue from some agent selling them Medicare health insurance. And they were both on a Medicare supplement plan. And the wife didn't want anything to do with it, but the husband was been talking about, I've been hearing all these ads on TV throughout the last few years about this Medicare Advantage. What is it? I can get all this free stuff, free dental, free gym membership, free health products, free rides to the doctors, a free robo-pet. Yes, believe it or not, that's an actual benefit that one carrier offers. So the Medicare Advantage plans are a private plan. It's not Medicare. It's a replacement to Medicare. So when you're on Medicare, you have two types of plan options. You can have Medicare driving the boat or the bus, and you can have a insurance company, a supplement insurance to Medicare, which is always triggered by Medicare. So if Medicare pays for your hospitals and your doctors and your surgeries and your lab work and all of your procedures that are medically necessary, typically with no prior authorizations, unless you're using the ambulance as your taxi service on a regular basis. Medicare may question that and may deny that, so be careful, those of you who do that. But with regular Medicare, you're not going to see prior authorizations. Medicare is going to pay 80% for Part B. They're going to pay the whole hospital bill except for a $1,600 deductible for every time you're admitted to the hospital. Well, if you have a good supplement plan, you're not going to worry about paying hundreds of thousands of dollars out of pocket if you have a heart transplant. It's not going to happen. You're going to pay next to nothing if you have a good supplement plan. You can keep your doctor. You can go to any doctor that accepts Medicare. The Medicare Advantage plans, on the other hand, work differently. And I'm not here to bash them or sing their praises. The truth is kind of somewhere in the middle. They have some good features. They have some features you need to be aware of. One of those is prior authorizations for procedures and tests, surgeries, whatnot. Networks, so your doctor usually needs to either be in network, or if they're out of network, you may not be able to have the insurance cover it at all. You would have to pay 100% of the cost out of your pocket. Or if it's a PPO plan, you'll pay a higher copay amount for that provider. So lo and behold, these people that live where we live here in Yakima County, and by the way, we're licensed in multiple states, so if you're seeing this video and you don't live in the state of Washington, you can still reach out to us. And also, feel free to subscribe to our YouTube channel and share this with a friend. It's very important, especially as we are currently in the midst of the open enrollment period, which goes through March 31st. Between now and March 31st, if you're on a Medicare Advantage plan, you can change to a different Medicare Advantage plan one time. And this is leading up to what I'm talking about. This agent called, who are now my clients, these people who are now our clients, new clients, out of the blue, last month in January of 2023, offering to move our client, the husband in this case, to a Medicare Advantage plan from a Medicare supplement plan. Now, the annual election period, which goes from October 15th through December 7th of each year, that's the period of time when you can switch from a Medicare supplement plan to a Medicare Advantage plan. During this time frame, from January 1st to March 31st, you cannot, in most cases, switch from a Medicare supplement plan to a Medicare Advantage plan. Well, this agent ignored that rule and switched him anyway to a plan in our county, Yakima, Washington, Yakima County, to a Medicare Advantage plan that isn't even offered in Yakima County. Humana left Yakima County about 7 years ago and is no longer in Yakima County. They're in our neighboring counties to the north of us and to the south of us, but not in the county where we live, in Yakima County. Our client repeatedly told the agent they were in Yakima County, not Kittitas County. So what happened was, we go to Medicare.gov and we want to find a plan that's in Yakima County. You can click Find Health and Drug Plans and find out all the different plans that are available in Kittitas County, where I used to live, by the way. That's where I went to college. Central Washington University Wildcats. So we can find what Medicare Advantage plans are in Kittitas County through Medicare.gov. By the way, we are required by phone call to say that all the calls are now recorded. And so in this case, I don't know if the agent did that or not, but there's a lot of scams out there, a lot of misinformation, a lot of telemarketers, a lot of junk mail. I had our clients bring in another piece of junk mail today saying call this number and you can get the benefits you're entitled to. So they moved them to this Medicare Choice Advantage plan for $199 a month. So they went from a Plan G, which was about $200 a month, to a Medicare Advantage plan for $199 a month. Well, those of you who are familiar with the Plan G, with Plan G, you have no copays. Medicare pays 80%, the Plan G pays the 20%, Medicare pays the hospital bill except for $1,600. You pay the $1,600 unless you're on Plan G or Plan N, where you don't pay anything for the hospital stay, for inpatient care. For skilled nursing care, Medicare pays up to day 100, but your responsibility is about $15,000. Both Plan G and Plan N, you have a zero copay, so you don't have to pay that $15,000 either. Under Plan G, you have zero copays. Well, this agent moved into this plan that's $199 a month for the month of February illegally because they're out of an enrollment period. Somehow Medicare approved this. We spent an hour on the phone with Medicare the other day trying to unravel this. So Medicare was able to cancel the plan due to misrepresentation by the agent and avoid them from having to pay all of these copays up to a potential $6,700 for in-network and $10,000 for out-of-network. Well, a lot of the providers in our area are out-of-network. So instead of having a $226 deductible, which Plan G has once a year, our client would have had a copay of maybe up to $6,700 or a $10,000 out-of-network for a premium about the same of what they were paying for Plan G. So all of these different copays would have applied if they got sick. So instead of having a zero copay for the hospital, they would have had to pay $325 per day for the hospital for days 1 through 4. The skilled nursing, which is covered at 100% by Plan G, they would have had to pay $196 per day for days 21 through day 60. That's thousands of dollars out of their pocket. So all of these copays would have added up to a potential of up to $10,000. So if you're on a Medicare Advantage plan, you're not going to want to, in most cases, pay $199 a month for that plan. The attraction to Medicare Advantage is low premiums, not high premiums. So if you're really interested in Medicare Advantage, that's fine. Feel free to reach out to us or your local agent or an agent that you've worked with for years and you can trust. And they can tell you the pros and cons of Medicare Advantage. A good agent will tell you both sides of the story. So the main thing is don't get connected with someone you don't know. They reach out to you unannounced, out of the blue. You don't know them from Adam, and they're trying to push one product. They have an agenda. So when I called Medicare today to confirm with our client on the phone, now our clients, that plan was kicked out that Humana Medicare Advantage plan. Yes, it did show on the Medicare website that it was, but it wasn't retro dated yet to February 1st. So to make a long story short, when I was calling Medicare, I misdialed and I got another phone number from an insurance agent, an agency trying to sell me insurance. So the phone number for Medicare, 1-800-Medicare, if you were to Google call Medicare, this is the number, 1-800-Medicare, 1-800-633-4227. By mistake, I dialed 1-800-533-4227. Have you ever done that? Have you ever misdialed by one and got some other number? Well, we're finding, our friends are finding that their agencies are getting copycatted for their phone numbers. They're changing one number. So if it's a 1-800 number, they might change it to 1-888. Or if it's an 888 number, they might change it to 1-800. Or if the middle digits are 424, they might change it to 434. Or if the last four digits are 5,000, they might change it to 5,002. So this is happening all over the place. If you call 1-800-Medicare and you dial one number off by mistake, you could get set up with this Medicare Advantage number. I tried another couple numbers and the same thing happened, trying to sell me Medicare Advantage over the phone. So be very, very cautious. So anyway, we called the State Department of Insurance today to file a complaint with this agent. And after we found out who the agent didn't even leave them a summary of benefits. They didn't even tell them what the plan covered, what the copays were. Our clients had no clue that they had copays. They thought they were just adding vision and dental and extra perks. Not the case. So by law, as agents, we are required to provide you what's called a summary of benefit notice. The plans are required to provide these booklets, either by email or hard copy, where you can read through the whole benefit package before you make your decision. They were not provided that by this agent. They were not told about the copays. They repeatedly said they were in Yakima County, not Kittitas County. When we called Medicare, they couldn't figure out how they got enrolled, but Medicare allowed it to go through. So then when we called Humana today to find out who the agent was, they gave us the name and number of the agent. We called that number and it went right to voicemail, and it said the voicemail box is full. So I went to the State Department of Insurance, which you can do. So if we can look up agents, you can file complaints, which we did. Spent about an hour on the phone with them today, so it's been over 2 hours we spent working on this case. So if you want to find your agent to make sure they're legitimate, you can type in our name. Now I'm James Richard McDermott, MacDermid. If you want to look me up on the State Department of Insurance. But in this case, we're going to type in the name of the agent, find out who this person is and where they're from. Okay, there they are. We're going to block out the name here. From Ohio. We'll block out the address as well. They are an active agent, so they are licensed in the state of Washington as a non-resident of Washington. And it shows they're just got appointed by these health insurance carriers this last fall. And brand new to Humana, November 21st of 2022. So what a new agent is going to do is they're going to try to create new business because they need new business because they're brand new. Nothing wrong with that, as long as you do it ethically and morally and you're competent. So either this agent was A, incompetent, B, immoral, or both, incompetent and immoral. It's one of those three things. So I would suggest you do this. If you don't know who you're working with, go to the Department of Insurance in your state, look up the name of the agent, make sure they give you the correct spelling. So while you're on the phone with that agent, you can look them up. You can see if they've had any complaints filed against them, how long they've been in business. You make sure you quiz them. Make sure they got your best interests at heart and they're not trying to pitch you one plan and they don't have an agenda. They need to be listening to you. They need to be listening to what your concerns are. This is not a one-size-fits-all solution. Everyone's got different preferences, different budgets, different needs. So we're going to take the time to make sure, any good agent will do this, to make sure that you are on the right plan for you. It's not what's best for the agent, it's what's best for you. These agents out there know that they can sign anyone up on Medicare Advantage because there's no health questions. Anyone can sign up for Medicare Advantage. Not anyone can sign up for a Medicare supplement plan unless you're brand new to Medicare in many cases. So a lot of rules to this. If someone like me can misdial Medicare today by accident, what could happen to someone that doesn't do this for a living? Be very careful. If you have any more questions about this, reach out to us at seniorsolutions.net or give us a call. We are here for you. Again, we can't promise you a smooth ride all the time, but we can promise you, if you decide to become involved with us, that we will be with you every step of the way, in the good times and the bad times. And I hope today is a good day. Have a great rest of your day, and share this with a friend.